recordings of this podcast can be found on raisingequity.org and Raising Equity on YouTube.
Welcome to the second season of Raising Equity. I'm so glad that you came back to spend some time with us. And to kick off our second season, we have a great researcher who's going to talk to us about how family and context and relationships impact the well-being of queer youth. Dr. Katie Heiden-Rootes is at St. Louis University in the Medical Family Therapy program. She's Director of Clinical Services and a certified sex therapist. Thanks for joining us, Katie.
Thanks for having me.
So I'd be curious if you would kind of just tell us how you landed on your research program, because the reason I ask for this story is that I think it's important that we understand when we focus on queer youth, queer youth aren't the problem. It's the context around them.
Right.
And
right.
so often people talk about, queer youth are at increased risk of insert so many things. But you correct me if I'm wrong, my understanding of the research is that they're at increased risk when the environment is not supportive.
Correct. So a big piece of what research has illuminated, thankfully, over the past decade in particular, has been that what really matters in terms of those really horrible outcomes is family and is the environment within which they're growing up. So when in a accepting and supportive environment, queer youth look like any other kid, and there's no differences actually. But it is that environment. And so for me, getting to this research, getting to this sort of topic area has been both personal and professional. I grew up in the church, as they say. My dad's a pastor. My brother's a pastor now. I really, religion organized my life growing up as a kid. And a piece of what happens in those contexts is you get particular language about sexuality.
You get language about sexuality in the church? Well, or is it omission or distortion?
Well, you get a finite amount of language. Okay. I'll say it that way. Like there's a real, here's the 4 things that we'd like you to know about it. And those 4 things really set up a binary of gay and straight. They set up a binary around gender, male and female. And then they set up a binary around right and wrong. So there aren't a lot of options. It's just sort of these are what is, and you need to be in this one in order to be good and right. And then if you're not, at least what was introduced to me was we have places where you can go to get fixed.
So conversion therapy.
Yeah. So I would be in religion class and we would be watching videos about conversion therapy, and they would be interviewing people who were part of it. And it was this wonderful story of redemption, change, that kind of thing.
Really?
But honestly, one of the most impactful moments for me is I was sitting there watching a video, and there's this woman talking about her conversion or whatever, and she looked sad to me. And I remember going, God, this isn't fitting. She looks sad to me. There's a sadness in her eyes. She's saying the right things. The language is there, right? So she's saying what she needs to say, but emotionally, it wasn't consistent.
How old were you when you saw this video and observed that?
16. See, I was a therapist when I was 16.
I was going to say, wait a minute, your clinical skills.
They developed early.
Clearly.
I was a middle child. So there was a there was a lot of me reading people and really started questioning then what I was being told. That led to a lot of conflict, as you might imagine, and also being an adolescent myself and really trying to figure out who I was, and feeling like I didn't quite fit in the binary, and I didn't quite know if I didn't fit in the binary, where did I fit, and not having any language about that. So it was a really, really sort of personal beginning. But then I found myself in my first job as a family therapist, being sent into homes, foster care homes, and encountering queer youth there, and still not having the language entirely. I had a few more things. I had come along. I had found ways to really come to my own sort of personal beliefs about being affirming of queer youth, but not having the word queer, and really just having still gay, bisexual, and lesbian. Those are sort of my 3 words that I had. But I was encountering youth who were not calling themselves anything really, and just sort of struggling to make sense of it. And then also encountering parents who are going, should we be afraid of this? Is this bad? What do you think? And I feel like I had a personal story about that, but I didn't have professional sort of help or practice. Like, what do you do as a therapist in that situation? As a person or as a friend, I could have said something, but as a therapist, this was 2006, 2007.
Okay.
And so I still hadn't encountered a lot of research around what you do as a therapist to help these families.
Yeah. So when you talk about language, when you use the term queer, I assume you're meaning it as an umbrella term that encompasses like non-binary in terms of gender and sexual orientation. Is that accurate?
Yeah. So the idea, the reason I use queer youth is to be an umbrella term, but also with youth to allow lots of room for them to move. I think when we get stuck in other labels, is he gay? Is she trans? What is that? When we get stuck in that, and then the pronouns attached to that, it leaves youth sort of being asked to make a choice that they might not want to make, might not be ready to make, might be still exploring or wondering about. And so queer allows lots of room for seeing these things as fluid and changing with lots of possibilities.
That's a really good point, right? Because developmentally, so much is happening. And I don't know if you could share a little bit with folks around like developmentally how we see sexuality, sexual orientation, gender, all of those things developing in youth. I know that in terms of like puberty, your body changing, relationships, peer group, there's so much going on. So it makes sense to try to give them as much space as possible to grow and be fluid and not feel like they mustered up the courage to say that they fit in a group. And then what if they explore and grow further and they don't? Then they got to come out again?
Right. Well, so the whole concept of coming out is problematic in my world.
Say more.
Okay. So there's a wonderful, wonderful writer and therapist, psychologist, actually, up in Minnesota, Julie Tilson, who does some writing on this. She's a queer theorist and a social constructionist, so language is a big deal.
Yes.
And she says the whole phrasing of coming out is problematic. The idea that I have to expose myself to you, somebody who could hurt me, where the impact of this is actually negative for me, and I'm supposed to help you out with this. It sets up this whole power dynamic that's highly problematic. And so she prefers the languaging of being invited in. So I tend to use that language with my families about your child finally invited you in to who they are. Isn't that wonderful?
That feels so much different, so much more authentic. And you're right, it is. It's like it's a gift if someone invites you in.
Right. And you're being invited into a relationship, so they're letting you into who they are in a way that is privilege, and in a way that means you need to be careful.
And it puts the accountability and onus on the receiver of the invitation.
Exactly. Yes.
That's beautiful.
Yes. I very much love her work for that reason, for giving me that kind of language to be able to say that. Because I think I found parents really respond to that. In the same way that like if a kid admitted to some kind of like sexual abuse or trauma or bad experience, we would language it that same way. And so why not use it here too, if it fits?
Yeah, absolutely. Absolutely. And that language also, I think, like you said, it gives them space to move and not feel like they have to like perform something or show something, right?
Right, exactly.
That's powerful.
Yeah, she actually, one of her books is all about that, about the performance of queer youth, that they're expected to be a particular way. There's a really helpful word for me is homonormativity. So the idea that there is a particular way to be gay, lesbian, bisexual, queer, whatever.
Right.
And that becomes another policing system about who you are and how you're supposed to perform. That really locks queer youth in, because what if they don't look like that? What if they don't fit into that? In the interviews I've done with queer youth, there was one in particular that stands out to me that fits so perfectly with that, where it was a cisgender gay man, and he goes, Because, the thing is, I don't look gay, but I have friends who do, and they get like really picked on more than I do. And nobody believes I'm gay because I don't look gay, and whatever that means.
Right.
And so he talked about that sort of at length, and his sort of shock or fear or concern about that he, in fact, what it set up in his family was he had to come out multiple times because they didn't believe him the first time. It's a phase, it's a this, did it come out.
Right. You keep being cisgendered and not looking gay.
Yeah, you wear baseball hats. Really stupid stuff like
right.
that.
But no, that highlights. So I love this because Raising Equity is all about pushing us as adults to do our own work, to be able to be adults in the lives of kids, to help them understand themselves, others, and be able to walk into their not just their adulthood, but themselves, to walk into themselves with an awareness of how systems are operating, right? So with an awareness that that there is not a binary that you have to live into or choose in terms of your gender and sexual orientation, right? Right. To be able to be flexible there, but then also to help them to see when you choose to identify that you then also don't have to abide by these rules.
Right. That the rules weren't necessarily made by you, so maybe you don't have to follow them.
And even if they were made by people who identify like you don't have to follow them. And sometimes I think about some of those rules around what do you have to wear if you're a lesbian, or how do you have to be if you're a gay man, right? It's very heteronormative, and it's just rooted. It just is perpetuating the status quo around gender. And
when you said that, I was thinking about how great it's been to watch football players come out. So places where you wouldn't expect, because I think about representation. So who out there is queer and looks like me, becomes a really common question.
Absolutely.
And can I look like me and still be queer is also often a question. And so when more people in places of status like that who aren't fitting into those binaries or stereotypes, it really opens up lots of room for kids to be different ways,
right,
and still sort of own who they are.
Yeah. So what do you find, when do you find youth are starting to come into their awareness of their gender identity and sexual orientation, their queerness?
Younger and younger and younger. I had the experience maybe 5 or 6 years ago where the families that were coming in, more and more of those kids were younger and younger and younger, and identifying either as trans or non-binary. And I was seeing fewer and fewer families who came in with a kid coming out as gay or lesbian.
So younger and younger, meaning they used to be 12 and now they're 7?
No, they used to be 17 and now they're 12.
Okay.
And I'm sure it's going to keep going down from there. So they're really young, and parents are really worried. The gender thing really seems to get parents, even seemingly progressive liberal parents. So the other thing I've noticed is routinely when the parents come in with a kid who's trans or gender non-binary, one of the things they'll say to me privately is, "But I'm liberal. I supported same-sex marriage. I supported." But I can't get my head around this. And so it's not, what it's broken up for me is that binary of conservative versus liberal and all of that nonsense, is that most of us, regardless of our political affiliations or who we think we are, still operate under the gender binary.
It's so powerful.
Yeah. And so the parents were really reactive to it and not knowing how to talk about it, and even really struggling with pronoun changes or name changes, or, the parents really, really struggle and need a place to kind of process that, because they're now up against everything they've ever been told, learned, expressed, experienced.
Yeah. So it's interesting that you say that youth used to say come out as gay, but now they're coming out as gender nonconforming or trans, right? And you tell me, but my thought is that it's because, like you mentioned, representation, language. It used to be we're more accepting in terms of sexual orientation, and there's less acceptance around the gender identity, but there's more exposure and language. And so young kids, if they're exposed and they get some language around what they're feeling or thinking or experiencing, they are, I would imagine, more open to accepting that than us older folks who are like so rigid in our binaries.
Yes, I would say the youth are much more accepting and open. And even among peers, there seems to be, at least I'm sure it's very context dependent, so depending on the school and where you're situated, but there does seem to be more of an openness around transgressing these ideas of binary and really kind of poking holes in some of the logic of them and why can't it be this way and why do my genitalia matter? So there's just a lot more pushback from youth in a lot of ways. Whenever I have I have a small private practice, and so every time I have a new client start who's queer, I feel like I'm learning where we're at now, because it just keeps changing, and there's sort of a keeping up with language and kind of what youth are talking about versus what adults might have been talking about. So it's fascinating.
I appreciate you sharing that, because I think that shows some humility and just models that as someone who, this is your research, this is your area of practice, you're still learning. And just because I hear from so many adults and parents in particular around their kids, right? Like they want to know, like, what do I need to know? What do I need to say? The kind of do's and don'ts. It's like, it's always changing. And there are ways in which you can kind of like be with your child that can help, like you said, help them invite you in. That regardless of whether you make a mistake or say the wrong thing, that like being present in a way that's open and accepting. Yeah. What would you suggest?
Yeah. So, I mean, as a therapist, I think humility is a good word. There's a lot of great writing now on cultural humility, and that being really the cornerstone. And so that's something I've really taken in as a therapist, but also as a researcher, that I need to know that I don't know, and that it's changing, and that I'm learning, and it's my job to keep learning. So I can't sort of rely on everybody else to fill me up necessarily, but I need to sort of see it as this ongoing process for me too. So with parents, I think of myself as modeling that for them, but also inviting them into their own sort of humility about this and what they don't know, and that that's okay. I think there's a lot of pressure on parents to know and to have all the answers, I think, culturally speaking, even outside of this topic, that we're supposed to be all knowing.
And we're so not.
And have all the right answers. But that you don't. And actually, one of your jobs as a parent is to get to know your kids, not that you already know them. And so what you thought you knew, you didn't know, which is okay. And they're inviting you in now. And so let's see what else they're willing to share with us.
Yeah.
And let's kind of roll with them. And I really, as a therapist and as a researcher, attachment theory is a guiding theoretical construct that I use all the time to talk about intersubjectivity. So this idea where your subjective understanding of yourself and your experiences is something I'm taking in and reflecting and understanding. And it's something I want parents to do with their kids. Intersubjectivity is like a really big term, but another way of thinking about it is attunement, where I'm sort of like tuning into like a radio and really taking in and feeling what you're feeling and understanding it. And I think with queer youth in particular, there's more fear that parents experience, more anxiety, where tuning in becomes harder because that anxiety or that fear becomes this like cloud between the two of them, and they can't quite get close enough.
So the parents' fear is creating kind of like static.
Yes.
So they can't quite tune in.
Right.
And that again is, it brings us back to this idea that the queer youth the youth in this example, they're just being a kid, living their life, right? Trying to have a relationship with their parent, and the adults' anxiety and all of that is creating the static.
Homophobia, transphobia, right? Like all that stuff for that parent that's coming up becomes just, it becomes static between the two of them. And then, what attachment theory says, if the parent can't tune into the child, then we have this insecurity that starts happening. And the parent doesn't trust the child doesn't trust the parent can't settle down enough to listen. because they're so reactive to everything that's being said. So the kid doesn't feel heard or understood. The parent, usually in fear, starts telling the kid about who they are.
Which then further disrupts the attachment.
Yeah, in therapy, it looks like the parent bringing in a picture of their kid from last year where they looked the way that they're supposed to look, and going, but she used to look like this. This doesn't make any sense.
Oh, that's happened?
Multiple times.
Really?
Oh, yeah. And they don't do it with the kid in the room, which I'm always very thankful for usually, but they do it just out of this sort of like fear and anxiety, and I don't get it, and I don't get it, and I don't get it. So one of the things I really, really encourage parents of queer youth to do is don't put the burden on your child to explain themselves to you. Go get some support. And then when you're ready and you have the questions and the language to engage them, then let's do it. And that's part of what I try to facilitate. And the research bears out that at least my study looked at how attachment security, even if parents are somewhat, the language we use is rejecting, but essentially can't really accept or understand or support their queer kiddo, if they can stay in a secure relationship with the child. In other words, the static is low.
Mm-hmm.
They're really tuning in.
Mm-hmm.
The kid feels like my parent trusts me and loves me and cares for me no matter what. The kid does okay.
Really?
Yeah.
That's important. That's important to know that even if I have all this stuff that's coming up, if I
Can manage
do
it.
my work and can manage it, that we can still stay attached.
Right. And yep, go ahead.
Well, I was remembering one of your research studies that I read that to me it's kind of the flip side of it, that if you are a parent and you're rejecting and you're judgmental and you're fundamentalist in your beliefs, right? Like that brings in the religiosity piece, that can impact and harm your child through the age of, was it like 30 something?
52.
52. Oh my gosh. For your life.
52. Yeah. So the effect lasted to 52 years old in our sample. And those folks who fared the worst had highly religious fundamentalist families that they came from, had parents who were very rejecting, overtly rejecting, like unwelcoming, you can't come home. And as you might imagine, the attachment security between them and their parents was really terrible, really low. They felt very unloved and unseen by their parents. So all of those things set up really high. We were measuring depression.
Okay.
So really high depression scores.
Depressive symptoms or actually diagnosis?
Depressive symptoms.
Depressive symptoms.
Yeah.
Okay. Yeah. Interesting. And tragic.
Yes.
So, I mean, what that tells us as adults is that we've got to do our work.
There's a big piece of when I have queer youth come in, I would say 50 to 75% of the work is parent work. And so people get really worried, that queer youth do need space for support. Absolutely. They absolutely do. My contention, and I think the research points this direction, is unless we intervene with the families and change the context, we can support them all day over here. And I think that's important work. And I'm so glad so many people are doing it. But I want to change over here. And I want to engage parents, because I do think there are more possibilities, even with conservative parents from more fundamentalist backgrounds. As somebody who grew up in that world, I know those parents desperately love their children.
Absolutely.
And the other interesting part for me about the more conservative religious groups is how seriously they take the job of being a parent. And so for me, that's a point of motivation. They so seriously take their role and the raising of children in a particular way. And if at least the church I grew up in, love was something that was talked about a lot, and grace was something that was talked about a lot. So there's still language within those religious communities that I have found useful for helping them sort of bridge that gap between, I don't know if I can change my beliefs to go to a pride parade or, vote for same-sex marriage, but I don't have to change my beliefs to love my kid or to enact grace in the way that I understand it. And that's really what kids need. They need parents who still make room for them and still literally want them, and at least try to understand them, and try to make that connection regardless of however they feel about, LGBTQ identities.
That's a hard needle to thread.
Mm-hmm. Yes. And I have been told it's not possible. So early on in my research work, I went and met with somebody who worked with parents of queer youth. And I was telling her kind of what I was thinking and what I wanted to do. And I was a doc student. So, I was naive and very idealistic. But she said, no, that's not possible. There's no bridge between those two worlds. And
so like fundamentalist Christian parents, that there's no way to support queer youth that are raised in that tradition?
Well, there's no way of keeping those parents and youth connected.
Ah.
Yeah.
Okay.
That there's no way of threading that needle. There's no way of bridging that gap.
Right.
And I remember walking away from that meeting going, that can't be true. Like that can't be in my world. I was like, that can't be true. But it was really sort of demoralizing. And I think one of the things now now that I've spent enough time with some of these parents, one of the things I understand is they don't think there's a bridge either because nobody's told them there can be.
So we come back to language. They've
been given a binary choice. So either you go to a pride parade and you become one of those people, one of those, liberal, crazy people, or you stay in this camp and you honor your beliefs, and that's the right choice. So they're given sort of these binary choices about who they can be. And they haven't been given a lot of gray space to know what to do in the middle. And one of them, I had an interview with one dad, and he was in tears telling me about his years of struggle from going from a fundamentalist, coming from a fundamentalist background, and having a child who came out as lesbian and a child who came out as trans, and desperately loving his kids and being told that he can't have a relationship with them. Mm-hmm. If they're going to choose that lifestyle,
they had to
cut the other language, cut him off. And then when he went to the queer community, he was told, you can't have religious beliefs. You have to choose your kids. Well, now I don't think all queer groups or people would say that, but he felt in this bind about what to do because of how desperately he loved his kids.
Right.
And just his struggle to find his way through that. And he actually went and saw a very good therapist, he said, who helped him sort of manage that. But the other part that he talked about was he really wanted to have a therapeutic experience with his kid, and nobody would see him with his kid in a therapy context.
Really?
Because he was the problem.
Oh, so he was the primary patient.
Right.
And they're like, why bring your kid into this?
Right.
Because you're the problem.
And your kid needs space where he's supported and you aren't supportive yet. So we don't want to bring you into that space.
Fascinating. Which you would think, well, maybe they're scared. I would think you'd want to, if the child is willing to come.
Right.
That's what systems therapy is about, right?
Right. And for me, though, it was another reminder of how much we don't know about doing family therapy with queer youth.
Yes.
There's exactly one study ever published on family therapy with queer youth. One. There's a bunch of theoretical articles. There's a bunch of ideas.
So tell me you have some in press.
There's some really smart people out there with some great ideas. I'm working with the people who did the one study on attachment-based family therapy with queer youth right now to work on sort of understanding this initial pilot with trans youth. So it's not impressed, but we're working on getting something there because we need to help the therapists understand how to intervene with these families safely, and in a way that's affirming to queer youth, but engages parents who are struggling.
Yes. And that's exciting because it is working with the whole system.
Right.
The system of the family.
Right.
The system of the religiosity, the religion. To help people who are inside those systems see how they're operating and have some choice.
Right. To give families other
options.
To
give them other options. So tell us about the pilot.
So the pilot was done by Jody Rusin when she was at Drexel. She's now at Virginia Tech. But she piloted attachment-based family therapy with trans and gender non-binary youth and their parents It's a pretty small sample. We had 7 whole families, but they went through 16 to 18 sessions of family therapy, which is a lot. And so we're going to look at video and do qualitative process research to watch how families change over time. And in terms of using attachment-based family therapy, what worked, what had to be modified, what came up that isn't addressed in the model that we need to address in the model. So the idea is to get sort of a bottom-up look,
Right.
As opposed to just static outcomes, but
Right.
also look at sort of the process. And there's also exit interviews from the youth about the experience. So we're hoping too that they'll inform what we do next.
Absolutely.
Mhm.
Absolutely. Correct me if I'm wrong. You have a group here in town
Mhm.
for
Mhm.
queer youth and their families, right?
Yes. So we have, we call it the Family Clinic for Queer Youth.
Mm-hmm.
And I wanted to call it the Family Clinic because I wanted it to be clear that we're engaging families.
Yes.
This is not just for the youth. A lot of people, that become, in our world, we call it the identified patient. So the queer youth becomes the identified patient, the problem, the thing to be intervened with. And that's not true. So when we were naming the group, I wanted to be really clear that we're intervening with the family because that's where change happens.
Right.
And so we're piloting this group of parents and kids, and then some sort of family groups and individual groups. We're noticing, though, a lot of people are coming in, particularly the parents going, I don't think I'm ready to face other parents.
Yes. I was going to ask.
That's a real struggle, but they're willing to come in. So we have a couple of just family therapy cases happening where they're not sort of ready to join a group setting because it feels, I'm sure, vulnerable.
And how does that intersect in terms of race, right? Like I'm thinking in the Black community, we have a lot of judgment.
Yeah.
And so I can think of folks who will say, yeah, I love my child. They've done some reconciliation, but yet to step into a group, I don't know if they'd be able to do that.
Yes. I think that's totally fair.
Yeah.
Well, and I think the other part, because I've been approached by Black families and African-American families in the St. Louis area about joining the group. And I'm also, a white lady from the suburbs. So I'm fully aware of that position as well. And maybe wondering about me and the kinds of judgment I'll have about them. So there is that intersection, though, of race that comes up a lot. There's been some pretty good, a few studies anyway, about queer youth who are kids of color and young adults, and how they are trying to reconcile or understand those two identities, or how much of them gets to show up in any one place.
And then you add religiosity.
Right.
So you have the church as well.
Right.
So are there any Black families in your group right now?
No, not right now.
It'd be really interesting to have a group of Black families and think about their experience. Because I feel like, has anyone studied queer youth who are Black or kids of color involved in church?
Ooh, that's a good question. Nothing's coming to mind, but that's a really good question, because one of the problems with getting to that question is quite often most of the funded research has to do with HIV. So when it gets focused on particularly Black gay men or men who have sex with men, which is the technical research term, it always gets predicated around HIV and AIDS. And so there isn't a lot of social exploration about their families or context. It gets real specific to prevention, disease, yada, yada, yada. Because when you said that, that's exactly where my mind went, was all of those studies.
Interesting.
But nothing about, not a whole lot. I mean, there's one of our students did a study on Black men from religious families, but it had an HIV outcome. And there's a little bit about family, but mostly it talked about the sort of the don't ask, don't tell rules in religious families, where people might know or don't know, but it's sort of on the DL, like nobody's going to talk about it.
Right.
But we know.
We love him anyway.
Yeah. He comes, he's in the choir and does all the things, right? Which is also a stereotype. But
yeah.
Right. So there's a little bit, but there's really not a lot, honestly. It's not I mean, I know current doc students in our field who are really interested in exactly that area and want to push forward in it. So I'm hoping it's coming.
Me too, because it feels really important.
Yes.
In our first season of Raising Equity, we did a whole series that was actually spurred by some of the homophobic comments that my oldest was hearing on Fortnite and at school. And so we did this whole exploration of talking to folks who identify outside the binary in terms of gender and sexual orientation. And for every person of color that we talk to, like it's core, right? Like, and oftentimes queer youth of color get lost in the margins. And so it would be really beautiful to think about how to support those families and navigate.
Oh, yeah. Well, and they're some of the most at risk for suicide and violence. I mean, trans women of color are
disproportionately.
Right. I mean, it's scary and frightening. And so those families in particular, in terms of an intervention, would be beautiful and needed.
Got me thinking. So as we think about what advice you might give to parents and talking to their kids about being queer themselves, or just the fact that queerness is in our society and should be respected, and what advice would you give to parents who are listening?
The advice I usually give parents is to stay curious with their kids, to ask more questions than have answers. So one of the things this recently happened actually to a friend of mine, her kid came home saying homophobic, negative things had been happening. And she sort of got scared and was like, I can't believe my kid doesn't know how I feel about this. And I said, well, have you ever told them? Right? And did you ask her more questions? Like, what do you think that means? And how did you respond? How do you wish people would have responded? What do you wish your friend would have said? To help them sort of imagine out other possible conversations. And, one of the things I say to my kids all the time is, people can love people of different colors and genders, and there's more than one gender or more than two genders. And we had this experience recently where one of my son's best friends is non-binary in elementary school. And so we've had ongoing dialogue about what that means and how he's understanding it. And it's been wonderful, but it has to be this conversation where you're asking questions and learning from and learning with and exploring things together. And then also, having to sometimes share, like, I know you heard that homophobic thing, or I know you heard that transphobic thing. That's not us. This is what mom believes. This is what I think is really valuable, that these are just people we need to love, and they're as worthwhile as you are.
Yep.
And if we lived in a different world, they could be exactly who they were, and this wouldn't be an issue. And so you find chances to get to impart that and say that, and correct some of the narrative they're hearing when they're at school. Contexts where you don't have control over everything that's said, and your kids are exposed to other things. And so needing to really actively be in communication with your kids about those things and not wait. I think too often parents wait until their kid's dating.
Yes.
Right? Like their kid's 15 or 16. They're like, okay, well, now we need to have the sex talk. And it's like, this kid's been a sexual being since they were in utero.
Right.
So the sex therapist in me gets really like, ooh, I feel like we need new development classes if you think you need to wait till 15 years old.
Right. And so often it's the fear on the parents' part.
Yeah.
Right?
Yeah.
That they're scared to talk to them, so they don't. But they need those conversations early and often, ongoing, right? And you can't give the sex talk, even if you give it at 5, the 5-year-old version, you still got to give it at 6, at 7, or ongoing.
Right,
it's ongoing. You got to
right.
layer that knowledge.
Right.
Yeah.
And keep developing it. And I would say the same thing about gender. So whenever, at least in my house, when we talk about sex and sexuality, we're also talking about gender. What does it mean to be a boy? What does it mean to be a girl? What if you're both? What if you're neither? What does that look like? How do you prefer to be? I mean, I have a 5-year-old who identifies as a girl and will not wear dresses, and knows that other girls do, and that this is a violation. And she goes, I just don't care. And I'm like, great.
Right.
Carry on. Right. So, but there's this ongoing conversation then too about gender and the way that we can transgress it and not necessarily live into it. My kids routinely comment on my shaved head as like some kind of point of contact. Well, mom has a shaved head, so like this somehow like now they have license to do whatever they want.
Everything goes. Anything goes.
But there's things like that. You're like, oh yeah, I guess that is a violation of all the ways that I'm supposed to be as a female-bodied person and blah 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 blah. Like, but kids pick up so acutely and quickly, I think, on things that we're not noticing, they're noticing. And for me, the fun of parenting has been sort of trying to understand their world and what they're seeing and really keeping up with it. And then following as they're sort of getting through things.
Yeah, absolutely. It's hard to keep up.
Oh,
it's so very hard to keep up.
It's very hard to keep up. Yeah.
If folks want to learn more about your work, how could they find you or follow you?
Well, I'm on Twitter, but I'm also, we have a website through SLU's website for the Family Clinic for Queer and Trans Youth. And then there's my faculty page there that has lots of my sort of current publications and that kind of thing.
Mm-hmm. What's your Twitter handle?
At KT and then Rootes, my last name, Rootes.
Wonderful. Wonderful. And you mentioned you have a small private practice. Is that something that people could contact you about?
Sure. Yeah. So that's in it's Webster Groves. I'm there just one day a week, but I share office space with some other private practitioners, and I mostly see things around sexuality and gender in couples and families.
Awesome. Awesome. Well, thanks so much for coming and sharing your frameworks and your ideas and your research. It's important, and I feel like it's a learning edge for me, a growth edge for me as I think about raising equity. A lot of the work that we have done has been around race, but some around gender and sexual orientation. And so it's a gift to me when folks come and share their expertise. So thank you.
Yeah, thank you for having me.
Yeah. And thank you all for joining us. I hope that you learned as much as I did, and that you think about how we as adults have our work to do so that we can support queer youth in being fully who they are. And hopefully we get that invitation into their world. Thanks for joining us on Raising Equity.